Many thanks for choosing us. At least 100 shots of the single-dose Johnson & Johnson vaccine have been administered to unvaccinated travelers who arrived in Ghana after 12 a.m. today. This is in line with the no vaccination, no entry policy announced by the Ghana Health Service as part of its efforts to prevent the continuous importation of COVID-19 cases into the country. Airlines will also be charged an amount of $3,500 for each unvaccinated passenger they bring into Ghana. But just some 12 hours after the rule kicked in, at least 100 unvaccinated travelers have had to receive the jab or be turned away. Let's speak to Manuel Cranting, who spent time today at the Kotoka International Airport monitoring the first day of the no policy, no entry. Well, joining me on the line is Public Health Director, Public Health Expert John Amoisi, who has joined us for more on this one. I'm grateful for your time, Dr. Amoisi.
Well, thanks for having me, Aisha. I trust everything is fine.
Everything is fine here. First, before we talk about the no entry, no vaccination, no entry, let me gauge your mood on this new research that we found on the Omicron variant. It says that it is it causes less illness, even though it is resistant to vaccines. What does this mean, Dr. Amoisi?
No, I think so far it's good news, and I must say that Dr. Salim, who is actually the lead in South Africa, their research institute, who broke this news yesterday to the BBC, did stress that these were still very early days. And as you know, this research was done out of a sample of 200,000 plus COVID patients in South Africa, out of which about 70–80% of them were COVID positive. So it's still very early days. The research was conducted by a research firm, and the research firm, of course, has this kind of data because they are concerned about their insurance claims, and so they collect very meticulous clinical data, which informs whatever insurance mechanisms they put in place. So what I'd say is, just as he said when he announced this, you have to take it with a pinch of salt. It is still very good news that it doesn't seem to cause as much hospitalization or severe illness as before. Now, what is a bit uncertain is you realize that in South Africa they have seroprevalence, quite a high seroprevalence actually. About 60% of the population has been exposed to the virus, and they've vaccinated also about 40% of their population. So that means that people who will be susceptible to severe illness on account of the virus would be much lower. This is compared to when Delta came in, and so it's really, really difficult to tell exactly whether the lower hospitalization and severe disease rate is purely a function of the kind of virus we're dealing with, as opposed to whether it's a function of all the other changes that have taken place over a period of time. So it's one of those we learn as we go, pieces of information, and it's just an additional building block, that additional brick that we can add as we try to expand our knowledge on this new variant and its implications for clinical outcomes and ultimately health outcomes, which would inform the kind of public health measures that should be put in place.
So what does this mean to us as individuals? Does it mean that we can easily go to sleep with regards to the COVID measures and COVID protocols that are in place?
Well, I say your guess is as good as mine. When you don't know, especially for something like a virus like this, you need to exercise the utmost caution, because the worst thing is to be caught flat-footed, or actually, let's use the expression, pants down, because then the repercussions are very, very high. I explained in previous interviews how some countries took certain decisions which could have gone either ways. But when it went bad, they paid a really, really high price. The UK is an example of that. Brazil and several others also examples of that. Examples of countries which actually were doing very well and based on their relative success decided to lower their restrictive measures. Case in point is India. And then we saw how the Delta hit them very hard. So if we were to take what we know now on face value, one would say, don't worry so much. We can take it easy. Not take it easy, but just continue as we are doing. But we are still learning, and the evidence on the ground or history shows us that when you don't know the full picture, the best thing is to have your guard up as high as you can. And then you only lower it when you have the full knowledge. And this is why I'm excited about the measures we took, and you were alluding to this, that we started jabbing people upon arrival in Ghana if they're unvaccinated. This is the kind of action that you want to take, really take the very high ground so that no matter how high the water rises, you're still safe. So yeah, I would say no, not the time to relax at all. It's just extra knowledge, which we add to what we know. And when we have the full picture, we can make a more confident, informed decisions about whether we could take it easier or not.
Well, there's a group that is questioning the mandatory vaccination upon entry into our airports. And it says that it's not right for the country to force people to actually vaccinate. What do you make of this?
No, I think these are really exciting times for public health law and for legislation in general. And we're really learning these kinds of activities, especially Ghana pioneering this, is actually going to go down in history. It's going to be used for a long time for teaching and as examples of how nuanced these kinds of situations are. We've seen riots in Berlin, Rotterdam, in other parts of Europe, and even in the US against vaccine mandates. From a public health perspective, if you ask me, I'm 101% in support of this decision. This is because there is freedom of movement. You can choose to come to Ghana or not choose to come to Ghana. But if you choose to come to Ghana, then what you have to do is to be vaccinated, and you're given that choice. And if you don't want to be vaccinated, you can choose not to come to Ghana. Under the circumstances, especially given our limited vaccination rates, given the difficulty that we have in enforcing the preventive measures like social distancing and hand washing and so on and so forth, it only makes common sense, let alone public health sense, that we should take this kind of measure. And I'm happy to engage in any debate on this subject. I think it's important that we listen to the arguments that people put forward. It's also important that we present the counter arguments and make this as intellectual as possible. But ultimately, I would say that this is a step in the right direction. And those who think that it's not fair or it's an infringement on their rights, I think they have a right to express themselves, and we should engage with them about my position based on what I would call common sense, and then public health knowledge would tell you that this is definitely the right thing to do.
Dr. Amwesi, this is their argument that even at the time when we were at the peak of it, there was no compulsory vaccination. And if you compare us to countries who had the vaccines, and in many of them had vaccinated, I mean, they have recorded more deaths than us. So with or without vaccination, we would survive. So it shouldn't be compulsory. It should be something that I feel like taking and not compulsory.
Yeah, the question is when we say we will survive, of course, everybody didn't die. People have got COVID more than twice. Some people have been vaccinated and still got COVID anyway. So those are not really the arguments. The argument is this: vaccination is an activity that one engages in not only for the self, it is actually for the collective benefit. Now, I can make this argument about, well, I've bought a brand new Mercedes-Benz AMG. It's a V8 engine, even a V12, let's say, and I want to exercise my car on the road and just do what I want because it's my car and I bought it and I pay my taxes and have the right to the road. Obviously, if I drive anyhow, and recently there was a Mercedes-Benz driver who drove anyhow, the streets of Accra. And he made the news. He was arrested, and he had his fair share, experienced the weight of the law. You can't do what you want because you feel it's your right to do it and it makes you happy, or you think that's best for your own personal well-being. In the case of vaccination, we've realized that people who are unvaccinated, and even people who are vaccinated, when they fall ill, they can carry the virus to other people. What that means is that when you get ill, you are putting others at risk. Now, when it gets to the point where by your actions, others are put at risk, then the rights become limited because we've got to protect others. If it was just a question of we are protecting you from yourself, that would be a totally different argument. But we're protecting you from yourself and you from others should you fall ill or be in a position where you're carrying the virus. And when those arguments are put on the table, it then takes away from the individuality. Now, moving forward, also looking at the numbers, you cannot just use the numbers comparing what's happening in Europe and North America to what we have here in Ghana and argue that because we've had relatively lower deaths, we should quit the vaccination. In actual fact, when you are seeing this, it is actually the time when you have to double down and put in place the most protective measures that you can. I always say this: public health public health measures are often counterintuitive, which is that when you're successful with public health, you actually don't see any trouble, don't see any issues, and this is the paradox. When there is no trouble, it means public health is working well. When there is trouble, it means public health is not working well. So we are always, caught trying to explain to people why we need to keep on doing what we have to do when they don't see any trouble. So the argument is that if we put in place these closures of the airport and closures of the borders so early and put in place certain measures that clearly helped us, it is actually evidence that these things do work, and this is the time to do them. We saw what happened in India, and there's enough evidence to show that places in the world with similar social demographics, weather, and other conditions are susceptible to very negative impact waves of this COVID. And looking at that is enough evidence for putting in place all the protective measures. And I've explained quite clearly how vaccination is perhaps the one single trump card which we can play and play really hard, because all the other measures are a lot more difficult to put in place than the vaccination. And by a large measure, the vaccination is the most effective out of the measures. And this has been proven so clearly, even here in Ghana. When you look at the people who are getting the COVID in our hospitals, it's more than 3 times the probability that such a person will be unvaccinated. I don't know what other data we want to see before we can make that argument that we need to double down on vaccination.
Dr. John Amoise is public health expert with KCCR. He's also a lecturer at the KNUST.